Candid Mouth Paint is an antifungal medication, known as clotrimazole, used in the treatment of oral candidiasis. It's commonly used for oropharyngeal candidiasis or oral thrush. So, let's take an in-depth look at its uses, how it is applied, and other essential aspects. When is Candid Mouth Paint used? Well, it is primarily prescribed for oropharyngeal candidiasis, also known as oral thrush, which is a kind of fungal infection caused by Candida species. Oral candidiasis typically presents as creamy white lesions on the tongue, inner cheeks, roof of the mouth, and tonsils. These lesions look like cottage cheese in appearance and give a cotton-like feeling in the mouth. White patches may be accompanied by redness, soreness, and difficulty swallowing food. How to apply Candid Mouth Paint? To ensure a correct application of Candid Mouth Paint, it is recommended to follow these steps. First, wash your hands thoroughly before and after applying the medication. The method of application involves using 10 to 20 drops of the paint, which is usually 0.5 to 1 milliliter. This is applied using a clean cotton swab. Dip the swab into the paint and apply it to the affected areas of your mouth. Make sure you cover all the affected areas with lesions. Apply 3 to 4 times a day for efficient usage. It is prescribed for about 2 weeks or as long as decided by your dentist, depending upon the severity of your infection. It usually takes 3 to 5 days to show any improvements in your symptoms. However, it is not recommended to stop usage once you feel temporary relief. Continue the medication for the prescribed time. Restrict from eating or drinking for a period of 30 minutes. This is because the medication must have enough time to work efficiently. Now, a doubt arises as to how long the medication must be kept in the mouth. It is advisable to refrain from rinsing for 30 minutes. This makes sure that there is sufficient time for the Candid Mouth Paint to be absorbed in the mucosa and act on the fungal cells. How does a Candid Mouth Paint work? You will be amazed at how this medication affects the fungal species. Clotrimazole in Candid Mouth Paint inhibits the growth of yeasts by altering the permeability of its cell membrane. This disruption of the membrane prevents the Candida species from producing ergosterol, which is a very crucial component of the cell membrane. Without this ergosterol component, the cell membrane becomes weakened, leading to cell death in the species. This, in turn, helps in controlling the infection. Are there any side effects of using Candid Mouth Paint? The medication is usually well tolerated, although little side effects may occur. This includes itching, burning, or irritation at the application site. You may experience allergic reactions like rash or swelling. It may produce gastrointestinal issues like nausea, vomiting, or an upset stomach if followed accidentally. Though Candid Mouth Paint is an effective topical medication for fungal infections in the oral cavity, always seek dental professional help before taking the medication. Never use any medication without proper prescription, as it may land you in other complementary side effects. Is Candid Mouth Paint good for mouth ulcers? The medication is not specifically designed for mouth ulcers. Although it can be used for ulcers caused due to fungal infection, it is crucial for you to consult your dentist before using the medication for appropriate treatment. How is it used for babies? Extreme care should be taken while applying Candid Mouth Paint to babies. Recommended only for kids above 3 years, it is highly important to consult a pediatrician or a pediatric dentist before using Candid Mouth Paint in babies. A smaller amount of medication must be used and rubbed on the white patches with clean fingers or a clean cotton swab. It is usually advisable to apply the paint after a feed so that sufficient time will be there for the medication to act before your baby's next feed. Follow good hygiene practices while feeding and sterilize bottles properly before feeding your babies. For more useful dental tips, log on to smile-wide.co.in.